This is not a dumb question at all. It's actually a fantastic question. So say you have gynecomastia, you're going to the plastic surgeon for evaluation. How do you know what surgery needs to be done, and how do you advocate for yourself and make sure that the right surgery is done? So whenever I evaluate patients with gynecomastia, the first thing to consider is it true gynecomastia or pseudogynecomastia? What is making the area enlarge? So with true gynecomastia, it's actual hypertrophy or enlargement of the glandular tissue. So when you examine a patient, you have a firm little nodule of tissue under the areola, and it can be very small, like the size of an almond, but it also could be very large. I've seen it up to the size of a tennis ball before. And depending on your overall size and shape of your chest, it can be very noticeable even with very small areas of hypertrophy. Now with pseudogynecomastia, it's usually a fatty tissue issue. So your fatty tissue in the area is hypertrophied and more than it should be. And on exam, fatty tissue is very soft. You won't have that firm nodule of tissue underneath the areola. So the treatment for these two things are very different. So if you just have a little area of glandular hypertrophy, then the treatment is either number one, to remove it in a surgical procedure where we make a small incision and cut the area out, or number two, there's minimally invasive options with the Miller procedure, so minimally invasive lump removal. And so you have a little probe that's put in through a tiny incision, and under ultrasound guidance, this little rotating chomper probe will chomp up the area of hypertrophy and remove it. Since the tissue is firm, it's not something that you can really remove well with liposuction. Now, with pseudogynecomastia, since it's fatty tissue, you're going to usually try to remove this as we would always with fatty tissue, which is from liposuction and not direct excision. So the goal is to make a little incision and liposuction that extra fatty tissue out. Now, the fatty tissue in the chest tends to be more fibrous, so my personal preference is to use ultrasound-assisted liposuction. I like the brand name Vaser, but I think that's a better option to treat that area. Now, in truth, even with true gynecomastia where you have a little bit of glandular tissue you're removing, most patients have a better cosmetic result if you also do some liposuction to smooth the area and to get the contour right. So even if they don't have a lot of fat hypertrophy in the area, smoothing the area for the contour is really helpful. Now, the last thing to consider if you're having gynecomastia surgery is what does the skin look like in the area? Some people have very tight skin and very good quality skin, and it shrinks up really nicely with whatever we do, liposuction or excision. And some people start out with very loose skin or not great quality skin, and the skin is going to hang. So it's important to talk with your doctor about what the options are for skin tightening. In general, skin tightening of the chest of a man leaves scars that can be pathognomonic, meaning they're kind of telling you what the patient had done. And so for most patients, we like to wait and see what the skin does, similar to other types of procedures we do, like liposuction or implant removal. We like to wait and see what the skin does, because in a lot of patients, it shrinks up enough and no surgical options need to be done. The other thing that you can consider is non-invasive skin tightening. So non-invasive skin tightening can be really useful in a lot of patients, especially if you do the recommended number of treatments and keep up with it. You can get 20 to 30% tightening in the right circumstance, and that can really make the area look good as well. So that is an option for loose skin. It really just depends on how loose your skin is and how well you respond to the non-invasive treatments. So in general, you really shouldn't, if you have an experienced surgeon, have to ask them to take out the gland. They should do that. I know there's people that always start with liposuction to see if they can make the area look better, and they only go back after the gland if it's needed, and that's not necessarily wrong, but I think most of us that do a lot of this type of surgery, we can tell when we examine you whether it needs to be done at the same time. I don't want you to have two surgeries if I know it's going to be two surgeries. I'd rather just get it done in one. So I guess my answer is that it's important when you're at the consult to ask your doctor, what do you think the problem is? Do I have true gynecomastia? Do I have pseudogynecomastia? And what is your plan, if it's true gynecomastia, to remove that gland?